The Oklahoma State Department of Health can't wait for the economy to improve or for the implementation of new taxes to shore up the state's budget. If lawmakers don't see fit to issue a bond to finance a new public health laboratory, the department says it will be forced to cease operations. The public health lab inside the Oklahoma State Department of Health building in Oklahoma City is more than 40 years old. In the last 4 decades, Oklahoma's population has grown by more than 1.3 million people, and technology applied in the lab has far surpassed anything imaginable in the 1970s. Unless drastic improvements to keep up with the times are made, the lab has been put on notice it will lose its accreditation. Dr. Terry Klein is the Oklahoma Commissioner of Health.
The concern is that if you don't pass accreditation, that you basically lose the ability to operate as a public health lab. For us, if we lose accreditation, we are required to shut down. We cannot continue to do that work.
To understand what that would mean, you don't have to look any further than our own children. Every baby born in Oklahoma must be screened for 54 different metabolic and congenital conditions. That screening is all done at the public health lab.
Some of the types of procedures are very time sensitive. That, as an example, with the newborn screenings, a day or 2 or 3 can make a difference for babies. Sometimes it can be a matter of life and death.
Where newborn screenings are sent and tested, there's a humidifier sitting in the middle of the room with an extension cord running from the ceiling.
Carter Kimball is the government relations liaison between the health department and the legislature. He has been trying to educate new lawmakers on why it is necessary to approve the issuance of a $58 million bond to fund the building of a new lab.
You can continue to do nothing, run the risk of losing the accreditation, and at which point you're paying almost twice as much to pay somebody else to do it, likely another state, because of the unique capacity of the lab.
Kimball has been with the department 2 years. Dr. Klein has been asking the legislature to fund a new lab for many years.
When I first made the request for this bond proposal to build a new lab, the cost for the lab was about $42 million. Today it's $58 million. And if we wait another 10 years, it'll probably be well into the 60s or 70s.
At a recent State Department of Health board meeting, it was announced that significant headway has been made to pave the way for a new lab. A bill authored by Senate Appropriations Chair Kim David has been approved and passed out of committee. The bill would authorize the state to issue a government bond to pay for the new lab.
And for a bill of this magnitude to be considered in the first week obviously shows that people are serious. That's a great sign.
Before the vote, members of the committee toured the lab to see the cramped space where some 40 technicians work on very sensitive materials.
Especially on the front lines of detecting bioterrorism threats. For emerging infectious diseases, we're usually going to be the first laboratory that will have those emergency use authorization tests to test for things like Ebola, Zika virus, West Nile virus, etc.
State epidemiologist Dr. Christy Bradley heads up the lab.
We have stairwells that flood periodically. That's a threat to our equipment. We also have problems with the HVAC system being loud, so it's difficult to talk in the laboratories in some places. Right now, where the lockers are for our staff doubles as a storage closet.
She says maintaining the right temperature and humidity levels to ensure the tests are valid is one of the biggest challenges. It's an issue for the whole building, which has not been properly maintained or updated during the last several years, where the department has suffered nearly a 27% cut in its budget.
This is one story from one agency, and that's being replicated. It's not that we've been singled out. We as a state are not adequately supporting core governmental services in our state, and the people will suffer as a result.
Dr. Klein applauds Senator David for getting the bill to pay for the new lab out of committee, but is concerned it will not be a slam dunk when it comes to the full legislature.
The challenge is our state has, for the last several years, shown a great reluctance to fund infrastructure and to purchase bonds to do the work and then to appropriate the money to retire those bonds.